Hi everyone, thank you for joining us today. My name is Gabriella Suggs, and today I'll be discussing an experiment titled "Are Messages from Media Enough to Influence Individuals' Opinions About the Pandemic?" conducted by both myself and Dr. Mark Chu. Problem. Risk perceptions play a substantiated role in precautionary and preventative health behaviors. As in the case of COVID-19, in the absence of proven vaccination, changes in social behavior such as quarantine, travel restrictions, individual protective behaviors, and the disbanding of public gatherings are adopted in order to control the spread of disease. As substantiated by Geana 2020, sources for obtaining information related to public health crises are of critical importance. Research regarding the formation of risk perceptions has indicated that perceptions are constructed from numerical information, personal experience, and the frequency in which a threat is represented within the media. At the time this study was initially proposed, the United States led the globe in positive COVID-19 cases, indicating that it is of particular interest to study the influences that media may have on risk perception, positive and negative affect, and the behavioral change as these relate to preventative health behaviors. To test our hypothesis, we measured the risk perception, affect, and willingness towards behavioral changes of individuals in response to media consumption. We hypothesized that those individuals in the condition of reading an excerpt from a factually based source will exhibit higher levels of risk perception, positive affect, and willingness towards behavioral changes than those participants in the remaining two conditions, reading neutral or false information. Method. There were 100 participants, including 24 males and 76 females. The average age was around 27 years of age. 43 of these individuals identified as white, 21 as Hispanic, 20 as multiracial, and the rest were identified under the category of others, which included Black and Asian individuals. Included is an overview of the three measures we examined within our survey. Risk perception. We developed this scale partially based on Conway, Woodard, and Zubrod 2020 with some modifications to assess participants' degrees of risk perception in relation to media consumption. It consisted of a 10-item Likert type scale from 1, strongly disagree, to 7, strongly agree. Sample items included the coronavirus, or COVID-19, presents a serious risk to public health, and the dangers of coronavirus have been over exaggerated, which served as a reverse scored item. Number 2, affect. Affect was assessed using the International Positive and Negative Affect Schedule, or short form, the PANAS. We modified the affects presented for relevance. This consisted of a 6-item Likert scale. Samples included alert and afraid, which was also a reverse scored item. Number 3, behavior. We developed the scale partially based on Conway, Woodard, and Zubrod of 2020 with some modifications to assess participants' degrees of behavior modification in relation to the coronavirus. This consisted of a 10-item Likert type scale as well. Sample items include, I find myself washing my hands or using hand sanitizer more frequently, and I find that the new rules and regulations are pointless, which was also a reverse scored item. This was an online survey. In addition to demographic information, the measures assessed risk perception, positive and negative affect, and behavioral change following participants having read one of 3 randomly assigned media excerpts. Survey questions were created on Google Forms, and the link was distributed to professors throughout our university, who then shared this link with their respective students. Students participating in the survey had a chance to receive extra credit points for participation. Results. A series of one-way ANOVA were conducted on all 4 dependent variables, and none of the results were significant. However, when we grouped participants according to their political party affiliations, the risk perception and the positive affect were significant. For risk perception, the 95% confidence intervals for Democrats were 4.84 and 5.49 respectively, which were significantly higher than Republicans at 3.17 and 4.27. as well as others at 3.83 and 4.74. For positive affect, the 95% confidence intervals for Democrats were 4.55 and 5.40 respectively, which were higher than Republicans at 3.19 and 4.7, with slight overlapping, but not significantly higher than others at 4.31 and 5.33. Conclusion. Findings showed that media excerpts shared with participants did not yield significant influence on their perceived risk perception, positive and negative affect, and behavioral changes. Instead, prior party affiliation seemed to demonstrate stronger influence that was in turn much harder to be altered. Here is a list of our references. Thank you so much for watching. We appreciate your time. Thank you.